So, I actually just filmed the video, but I just want to say, I'm going to put this in before I put that other clip in. I just want to say, if you're looking for a video from a medical professional, okay, this is absolutely your channel. No, I'm just kidding. I'm not a medical professional. I just want to say, use this technique at your own risk. However, I have put a lot of research, time, money, and things like that, as well as I've done a few different hands-on courses and to better myself in first aid. So this is what I've seen many people online do, and this is what my instructors informed me to do. So I've took many courses with the Boy Scouts, First Aid Merit Badge, Wilderness First Aid. Then I took a class with an EMT on the side that was like emergency medicine. So I do know quite a bit about all of this, but like I said, I am not responsible at all. Say if you try to do this technique and someone dies, okay? So I'm not accountable at all for this, but this is the technique that I would use, and in my opinion, for high junctional bleeds, like right here where you cannot apply a tourniquet, especially with a hemostatic agent, this is the best way to stop bleeding from arteries from there. So, enjoy the video. Hey guys, Jimmy here on Suburban Survivalist. What we're going to be doing today is how to treat a arterial bleed. Okay, so I made a redneck arterial bleed simulation. Okay, and what this is going to be simulating, so this would either be the humerus or the femur, this bone right here. Okay, and then this is going to be simulating an artery coming through. Then this would be the muscle. Okay, and the first thing I want to say is this is going to be wound packing. Okay, the first thing that you're going to want to do, if you can, is apply a tourniquet. If this injury is in a place where you can apply a tourniquet, apply a tourniquet. But if it's in an area like right in the shoulder or in the groin where you can't apply a tourniquet, this is your only option. So then what you're going to need to do is before you perform any aid, you need to put gloves on. Okay. Then you're going to take either a clotting agent like Quick Clot or normal gauze like this. Normal gauze, okay? So then you're going to open your gauze, and this, for a real life wound, you're going to want a much larger roll than this. And then this is going to be simulating this is an ACE wrap. What it's going to be simulating is basically a Israeli or pressure dressing. Okay, so the first thing you're going to do is tie a knot in your gauze so you have something to work with, or just make like a little clump. Then start pumping. Then you're going to take this. Yeah, you're going to start. So that's what it's going to look like. It's going to be bright red blood squirting out. You're going to take your gauze, stuff it in there. You want to get it right to the thing that's bleeding, right to the thing that's bleeding. And you're going to pack all this gauze right in there. Now, my father, he's the one that's pumping it. It's getting very hard for him to pump because I'm just packing these gauze in as hard as I can. Okay? Then whatever's left after you've filled the entire wound, okay, you're going to place that there. Take your wrap, and you're just going to wrap that as tight as you can. Then, when you get over the wound, you're going to twist, putting extra pressure down onto there. Then just keep finishing that wrap. Go above the wound and below the wound to prevent infection. Okay, and then you should not see any blood leaking out of the dressing. Okay, so Dad, try to pump a little bit, and he can't get anything through. Okay, because this is locked off. Okay, so this is an emergency medical procedure that you cannot leave this like this for very long. So after you've completed this, then what you're going to need to do is you're going to need to get to a doctor or a hospital or something like that and then they need to handle everything from there. This is not a long-term solution. This is going to save your life, okay? So if you get an arterial bleed, you can bleed out in 60 seconds, and you can die right there, okay? If you don't know how to treat arterial bleeds and things like that, if you get one, you're going to die, okay? So this is how you do that. Then you could just tuck the end under, and then try to stabilize the patient. Avoid moving them as much as possible. And if blood does start to leak, just try to put extra pressure on it with your hand, or you can try doing something else like wrapping again or putting another dressing over it. Try to avoid removing this dressing, because then that can remove any clot that did form. But thanks for watching. This was Jimmy on Suburban Survivalist. If you want more medical videos like this, or like how to treat burns, things like that, I can totally help you with that. Thanks for watching, and I hope you never have to use this technique.